let's go across to Dale Fisher, who joins us now from Singapore. He's a senior consultant at the National University Hospital in Singapore. He's professor in the infectious diseases department of the National University of Singapore. He's the chair of the Global Outbreak Alert and Response Network. Dale Fisher, thank you for speaking to us on NDTV. First and foremost, Singapore now joining a chorus of countries globally, India included, that have tightened people's mobility to stem the spread of the coronavirus. Why this step now? Because when you look at the cases in Singapore, very different, even from India. We've crossed the 2,000 mark.
Thanks. It's my pleasure to be here. Recently, over the last 2 weeks, say, we've had a lot of returning people from overseas, largely Singaporean residents, and there have been quite a few clusters lately in nursing homes, in dormitories of, crowded dormitories of often foreign workers. So it's really been about just reining that back in. Even if our maximum number of cases has been 70 in a day for a population of 6 million, it's not big numbers, but it just shows you the respect we have for how this can get away from you. So this is being called a circuit breaker. We just want to wait a month. All our systems are in place. They're all working well, but it's just, let's draw a line in the sand. Let's bring it back in, and then we can undo things again.
All right. And I want to touch on one other aspect, which is a change in mindset. This is what we're seeing globally. We're seeing more statements coming out and more rethinking of advice on masks. We've also hearing that out of Singapore, where the government is rethinking advice that they had said earlier, that only those who are ill need to wear a mask.
So we still adhere to that. We don't really believe people should be wearing masks out in general public, but we also understand that people feel more comfortable taking this measure. Our stand hasn't changed, that if you're sick and if you're sick, stay home. If you're sick and you must go out, then wear a mask. But to sort of curb that desire of people that want to wear masks, we're going to be distributing reusable masks, because we really don't want to impact on the medical grade masks, which are crucial in the healthcare sector.
And, many examples could be taken from Singapore. They've been looked at as an example globally because you were being hit months ago by the virus. Singapore, along with some other Asian societies like Taiwan, Hong Kong example, they all were hit about a month ago, yet they've recorded only a handful of deaths and relatively a few cases. So what lessons, why do you think that is, and what lessons could be learned from Singapore for other countries where, like India, now cases are now starting to rise?
So we've had from the very outset very freely available tests.
Yes.
We isolate all our positive cases. We do aggressive contact tracing and quarantine these people. So we've been very aggressive attacking the virus, if you like, rather than putting the emphasis on society and the societal interventions, although they're very important as well in terms of the safe distancing and avoiding crowds and hand washing and things like that. So I think it's more about doing all the right things, but doing them very thoroughly. Other countries may not have the same capacity to do a lot of these things, but governments are going to need to adapt and adjust to turn this into an outbreak response, not an economic response to a viral illness.
So, but how many of these lessons can actually be replicable? This model, can it be replicable, you think, in other countries like the US, for example? Because Singapore, one of the cleanest in the world, cities in the world, high populations like many Asian societies, but CCTV cameras everywhere, immigration records, like you said, you can trace someone down. The information about anybody who has been tested positive is put out immediately so that everybody else can protect one another. I'm asking about infringements on individual liberties. That's something that people in Singapore are aware that they have to give up if they want to live there. perhaps now, I'm finding no easy way to say this, that is of an advantage for the Singapore government?
I think it was an advantage at the start, but I think now other countries around the world are realizing the price for those liberties, if you like, and you couldn't say that many countries in Europe and the US, states in the US are actually that are undergoing lockdown. They've had those liberties deprived to a much greater degree. So I think at least during the period of this outbreak, people have to understand that there has to be a lot more infringement, I guess, on your privacy in the interests of contact tracing and making sure the cases are shut down, the transmission chains are stopped.
But also the vigilant, these monitoring systems that were put into place, I think, 17 years ago when SARS, when everyone was dealing with SARS, those weren't removed. Like they're still being investments were still made into them, unlike the US, for example.
No, I don't think that's so. There's lots of CCTV cameras around, just part of, businesses' security. I don't think anyone in Singapore really feels Big Brother is watching you, but we're certainly able to leverage off those in this situation. A lot of our contact tracers are in fact policemen. So if someone says I was at a restaurant that night, they, very comfortable to walk into the restaurant and say, I need to look at the CCTV cameras to work out who was near that person because they're contacts now, and this is our way of shutting down the spread.
No, what I meant is that the US disbanded its pandemic response unit in 2018. But one last question. Economically, when you heard the PM's statement, he said that basic essentials and certain economic units are still going to be working. How is that going to work out? Because as India, we're now in our 10th day of our lockdown. Many questions being raised about the impact on the economy. The economy completely stalled right now. Singapore seems to be playing a fine balancing act that they seem to be at least attempting to pull off.
Well, every decision is made on the basis of the outbreaks we're seeing. So if we're seeing outbreaks in dormitories, for instance, of construction workers, so we say, okay, all those construction work needs to stop because this outbreak could really explode in those areas. So, no, I think it's quite strategic. Often in the financial sector, there's a greater potential to be able to work from home. So maybe there's only, 30% of the people actually going to work anyway, and they can distance at work. So there's no accidents in these decisions. These are all sort of strategically described. But there's also a stepwise thing. It's not like you have to shut down everything. It's let's shut down a certain number of things, and maybe next step might be more. But ideally, the next step would be less because the transmissions come under control.
All right, Dale Fisher, thank you. Thank you for joining us.